Patient Assessment Medical. This station is designed to test your ability to perform a patient assessment of a patient with a chief complaint of a medical problem and voice treat all conditions discovered. You must conduct your assessment as you would in the field, including communicating with your patient. As you conduct your assessment, you should verbalize everything you are assessing. Clinical information not obtained by visual or physical inspection will be given to you after you demonstrate how you would normally gain that information. You may assume that you have 2 EMTs working with you and that they are correctly carrying out the verbal treatments you indicate. You have 10 minutes to complete this station. Takes or verbalizes body substance isolation precautions. Determines the scene is safe. Determines the mechanism of injury, nature of illness. Determines the number of patients. Requests additional help if necessary. Considers stabilization of spine.
BSI, scene is safe. We were dispatched to a middle-aged female with chest pain. We were requesting an ALS ambulance. For our additional resources, we appear to have 1 patient. Hi, my name's Amber. What's your name?
Cassandra.
Cassandra, why are we here today? What happened?
I'm having chest pain.
So we're going to update the responding ALS ambulance. We have a patient complaining of chest pain. Did you fall today?
No.
No? Okay, so we're ruling out cervical spinal injury.
Verbalizes general impression of the patient. Determines responsiveness, level of consciousness, AVPU. Determines chief complaint, apparent life threats.
Tell me what day it is today.
Today's Tuesday.
Tuesday.
Yeah.
What time of day it is?
It's noon.
It's noon? Okay, and where are we?
I'm at home.
She's at home, so she's consular and oriented at this time.
Airway and breathing. Assesses and maintains airway. Initiates appropriate oxygen therapy. Assures adequate ventilation. Manages life threats to airway breathing.
So I'm talking to the patient. She is consular and oriented, speaking in complete sentences, so her airway is open and self-maintained. She is breathing at this time. I'm gonna listen to your lungs, okay? So I'm gonna listen in 2 places. Take a deep breath. Okay, take a deep breath. I'm gonna put my hands on the side of your chest just so you can take a deep breath, okay? We do have equal bilateral breath sounds at this time, equal chest expansion. We are going to place the patient on a non-rebreather mask because you are complaining of chest pain, okay? At 12 to 15 liters per minute.
Circulation. Assesses controls major bleeding. Assesses pulse. Assesses skin, color, temperature, and condition.
I see no obvious hemorrhaging at this time. Skin is cool and clammy at this time, and the pulses are weak at the radials.
Identifies priority patient, updates the responding EMS units with brief report.
So we're going to update the responding ambulance. We do have a consular and oriented patient maintaining their own airway with equal lung sounds. We do have weak rapid pulses at this time with cool and clammy skin, and it's going to be a priority transport.
Obtain baseline vital signs. Pulse, respiration, blood pressure, skin.
So I'm going to assess your heart rate at this time. The heart rate is 74, strong and regular.
Pulse is 124 and weak.
Pulse is 124 and a weak radial pulse at this time. I'm going to assess for respirations. Respirations are 18 and non-labored.
24 and shallow.
Respirations are 24 and shallow at this time. Skin is warm, dry, and unremarkable.
Skin is cool and clammy.
Skin is cool and clammy at this time. I'm going to assess a blood pressure. It's going to go right around your arm. You can just rest your arm like that. Thank you. just going to get tight on your arm, okay? Blood pressure is 128 on 76.
Blood pressure 144 over 92.
Blood pressure is actually 144 over 92.
Secondary assessment: onset, provocation, quality, radiation, severity, time. Allergies, medications, pertinent past medical history, last oral intake, events.
So I'm going to do my OPQ or STI questioning at this time. What were you doing when this started?
I was taking a nap. It woke me up from my nap.
So you were taking a nap and it woke you from a nap? Okay. Does anything make it better or worse?
No.
No. Can you describe the pain for me?
It felt like indigestion, but now it feels like a weight is on my chest.
So it started like indigestion, now it feels like a weight is on your chest.
Yeah.
Okay. Does it go anywhere from your chest?
It started in my jaw and shoulders. Now it's in the middle of my chest.
So it's in the middle of your chest and goes to your jaw and both your shoulders.
Yes.
Can you rate it on a scale of 1 to 10, 10 being the worst pain you've ever felt in your life?
I would say a 10. It hurts really.
It's
really
a 10.
Yeah.
Has this ever happened to you before?
A couple of times I have medication for chest pain.
Okay, it's happened a few times before this. I'm going to go into my ample questions at this time. Are you allergic to any medications?
No.
No. Do you take any medications for this?
I take nitro.
Okay, you take nitro for the pain?
Yeah.
Okay. Do you have any past medical history?
No.
No. You have heart problems in the past?
Yes.
Okay. When was the last time you had anything to eat or drink?
This morning.
Okay, you ate breakfast this morning?
Yeah.
Okay. And you said you were taking a nap when this started and it
Yeah.
woke you from the nap, so the events leading up is that you were taking a nap?
Right.
Okay.
Assesses appropriate body systems. States general impression. Verbalizes appropriate intervention and treatment. Reassessment. States when, how frequently reassessments will be done. Appropriately verbalizes report to arriving ambulance crew. Complete station within 10-minute time limit.
So at this time, I'm going to do a cardiac assessment on this patient. I'm going to listen to lung sounds in 4 places. Take a big deep breath for me. And another one. I'm going to listen down on the side. Okay, big deep breath. And again on this side. Big deep breath. Okay. I'm going to assess for equal expansion. I'm just going to put my hands around you again. Big deep breath. We do have equal expansion at this time. We're going to assess for any pedal edema, see if it is present, and if so, how bad. I am going to update my ambulance. I do have a middle-aged female complaining of chest pain. She is condylar and oriented at this time. It still appears to be clammy and diaphoretic. We're going to check her oxygen therapy, continue oxygen, possibly assess the patient with her own nitro because her blood pressure is over 120 at this time. Continue reassessing her with vitals every 5 minutes because she is a critical transport. When the ALS ambulance arrives, we are going to inform them we have a middle-aged female conscious on alert. Respirations are 28 and shallow at this time. She does have pulse rate of 128. We get the radials with a blood pressure of 142 on 90. She is complaining of 10 out of 10 chest pain, and she has taken nitro without relief prior to our arrival.